For more on vaccine safety, let's bring in infectious disease specialist and ABC News medical contributor, Dr. Todd Ellerin, on this. Dr. Ellerin, the woman in that piece was worried about future infertility after getting the vaccine. What data do we have on that right now?
Diane, there is no data on this. There's no credible biologic mechanism. There's no plausibility that the vaccine itself is going to affect fertility. And in fact, remember, we haven't heard anything that COVID-19, and there's been hundreds of millions of people around the world that have been infected, and we're not hearing about any fertility issues. So I do think this is important. There is disinformation out there. We do have to combat that. It's not enough for me to say that there's no evidence. We also want to see people come forward, women who have been infected before and who get pregnant and have healthy pregnancies and normal babies, and we want to hear those voices so we can sort of have an evidence-based approach, but also an emotional approach. This isn't all about the science. This is, a hot emotional topic. So, but so
sure
far,
is.
I would say,
Well, I think you were about to get to this, but so if you're an employer in this situation, how do you ensure that your employees, one, have the most accurate information out there, and how do you navigate what are clearly complicated waters?
So, Diane, these are complicated waters, and you're looking at someone right now who's an employee of an organization that has mandatory influenza vaccinations. Let me be clear. If I don't get my flu shot this past year, I will be terminated, okay? So, and remember, you're battling the principles of beneficence, wanting to do good, to not do any harm, to keep workplaces safe. And we know that vaccines will obviously help that, versus autonomy, where we want, ideally, people to be able to make their own decisions. But when it comes to major public health implications, you can understand why organizations could want to mandate this to make sure that the workplace is as safe as possible.
So what do we know so far about virus transmissibility after getting the vaccine?
So good news on this front. So remember, transmissibility is a complicated topic because as we see cases go down, it's not necessarily all about vaccine. It could be about natural infection and more of us becoming immune that way. It could be because we're masking, more distancing. But here's the good news. Moderna, after a single dose, 2/3 reduction in finding virus in the back of the nose. AstraZeneca did weekly swabs after their placebo and vaccine groups as part of the clinical trial. They showed there was a 50% reduction in finding virus in the back of the nose. So we've seen, and there's multiple groups right now that are looking at this in Brazil, in the UK, and Israel. And the other good news is it looks like after you get vaccines, you actually have less virus. Even if you detect virus in the back of the nose, there's less of it. So there's a good chance that this will ultimately translate into decreased transmission. We obviously know they're wonderful at preventing severe infection or moderate infection, but now we're trying to see, will it help decrease transmission? I bet it will, and studies are ongoing to show that.
That's great news. And on that note of preventing infection, there's some new evidence now showing that just one dose of the Pfizer vaccine is 85% effective there 15 to 28 days after being administered. So could this change the perceptions about maybe delaying the second doses of the vaccine and getting as many first doses out there as possible?
So more good news, right? This is a study out of Israel. They vaccinated thousands of healthcare workers. I want to remind you, these healthcare workers were mostly young and healthy. But what they showed is that there was a significant reduction in overall effectiveness, decreasing moderate or severe symptoms after a single dose. Okay, that was, as you quoted, by 85%. But they also showed that there was a 75% reduction in overall infections as well. That includes symptomatic and asymptomatic. Again, another clue that what we're going to see is that we're decreasing transmission. Now, I don't want to say that that should translate into that we become a single dose, world. But I do think for people that may not be getting the Pfizer vaccine right after 3 weeks or Moderna after 4 weeks, maybe 6 weeks go by, maybe there's supply chain problems where people can't get it 8 to 12 weeks out. I do think that overall, that if there's spacing in between that first and second dose, that it still will be very effective.
And President Biden is expected to announce that the U.S. will contribute $4 billion to global vaccine efforts. Now, there's been some outrage to that from Americans who haven't been able to get their own vaccines yet. So what do you make of this debate and this effort to help get the world vaccinated when the U.S. isn't yet fully vaccinated?
So I want to, clear up any misconceptions about this. President Biden is not saying that he's taking money that is going to allow for more vaccines for the United States and shift it over to COVAX. That's not the case. There's this extra money that he's going to be putting towards COVAX, which is basically an international alliance between the WHO and Gavi, and Gavi is essentially a global organization to try to get vaccines to the resource-poor countries. So this isn't just vaccines for the haves, no vaccines for the have-nots. I think it's a wonderful initiative. It reminds us, remember, this entire pandemic started with 1 or 2 cases in Wuhan that was left unchecked. And now in the United States, not in China, but in the United States, we have the most cases, the most hospitalizations, and the most deaths. So what happens in one part of the world affects us. How I handle myself affects you, Diane. So we have to remember that. I think President Biden is putting this, as a priority, and I like it.
All right, Dr. Todd Ellerin, always great to have you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.